Hi guys, good morning, good afternoon, good evening, wherever you may be in the world. I'm Dr. Dan, clinical dementia specialist, and happy Valentine's Day. If you celebrate it, I hope you're having a fantastic day and a great week. Today's video, I want to talk about something called normal pressure hydrocephalus, or if you're an American, normal pressure hydrocephalus, however you pronounce it. Why are we going to talk about that today? Because you may or may not know this, it is a form of dementia. It isn't a primary dementia like vascular dementia or Alzheimer's disease or Lewy body dementia. It's what we call a secondary dementia. So it's something that we can treat, it's something that we can reverse, it's something that we can manage effectively. So what is it? Well, normal pressure hydrocephaly, and it's called normal pressure because even though there's an extra buildup of cerebral fluid, CFS, get my words here. I've tried this a couple of times this morning. I'm not going to stop. I'm going to carry on. CFS, cerebrospinal fluid. Yeah, cerebrospinal fluid, CSF. This could be an outtake, but I'm going to carry on. CSF. We have a build-up of it, and it doesn't cause swelling of the brain. It doesn't give that pressure. Well, that's why it's called normal pressure. It doesn't change the pressure in the brain. But what it is, CSF is, it covers the ventricles in the brain. It's like a sponge, helps to protect them from damage. And it also provides nutrients and can help remove waste products too. We all have it, we all need it. It helps keep our nervous system healthy, our central nervous system. So we need it. Sometimes there's too much of it. We produce too much. Why do we do this? We don't really know. On the whole, we don't know. Age could be a factor, brain injury could be a factor, brain tumour could be a factor, brain surgery could be a factor. But really, we're not 100% certain what causes it. We see it more in people over the age of 60. We know that for a fact. So that could be one of the reasons. But as I said, we're not 100% certain. How do we see it? How do we notice it? What are the signs? Well, it's really a lot to do with how we walk and our balance. We walk differently. We will change the way we walk. We'll change our posture. We might be wobbly. The way we actually walk normally might change. What is normal for us, for you as an individual, because we all walk differently. So the changes in that. Falling over is another thing. Memory issue, dementia type symptoms are part and parcel of it. So what happens? What do we do with it? Well, treatment and therapy. A neurologist, a neurosurgeon will diagnose it and then will fit something called a shunt. Now, a shunt is a tiny, tiny tube that goes into the ventricle in the brain and then feeds through the head, down the body, under the skin, and into the abdomen, so that it can drain. Excess fluid will drain and be absorbed into our natural system and disposed of accordingly. The shunt sometimes needs to be adjusted, and sometimes it takes a little bit of time to adjust it to the right fit for that individual. But once it's done, it's great. It does its job. So that's the physiological aspect of it. Sometimes it'll change people's mood. Sometimes, and research is very varied on this, but research shows that between 14 and 46% of people who have NPH will also experience depression. So what do we do with depression? How do we deal with that? How do we manage that? How do we treat it? And also memory issues. What can we do to support that? So as everybody knows who follows my channel, my triadic approach for treating people with all kinds of neurological and neurocognitive disorder consists of cognitive behaviour therapy, hypnopsychotherapy, and the third thing being brain health therapy. So those three things combined, I always use them in my treatment plans. There might be other things we put in there as well, but those are the three, the triadic approach. Somebody who has an NPH and who is experiencing both depression and a memory issue, we want to treat depression with quite possibly a short course of antidepressants, a short course, adjunct for treatment. So it's just a short course to help use cognitive behaviour therapy and to use brain health therapy to get that individual to a point where they're now managing, the depression is managed, the NPH symptoms are managed, and through observation and continued support and treatment and therapy, we ensure that the person who's living with NPH has the best quality of life possible. Some of the things I just spoke about there was the cause of it. And we, as I said, we don't really know what the cause is, but age could well be a factor. Age is often a factor in many neurological and neurocognitive disorders and diseases, as well as maybe some genetics, heredity, or injury, as we said. So normal pressure hydrocephalus, it's something that can be treated, it can be managed effectively, the symptoms can be managed effectively, many of the symptoms will go away, especially the physiological symptoms, and it's mainly then the psychological strategies that we're working with, because it can change somebody's life. And as I said earlier, I have a number of patients who have normal pressure hydrocephalus, and it has changed the way they live their life a little bit. They've had to adapt things. So that's normal pressure hydrocephalus. Sorry about the dodgy start, but I'm normal, I'm human, and if I stopped every time I made an error, we'd never get these things done. So thanks for watching the video. If you have any questions, please let me know. Nobody's asked any questions outside of my clinic about NPH, but if you do have any, please fire them off to us. Go to my website, find out what I do, read about stuff on there, contact us through there. My email is drdan@drdanielnightingale.com or lynn@drdanielnightingale.com. You can contact us that way. Please follow us on Facebook, Instagram, and share this knowledge with people. Everything we are doing with Instagram, Facebook, and YouTube is all about education. I want to educate people in the best possible way so they have accurate, up-to-date information about neurological and neurocognitive disease and disorders. So, thank you very much for following me and being with me on this journey. And remember, guys, say it with me, dump the soda.